Good morning, everyone. Thank you for being here. I'm Tom Burke. I am the president of St. Francis Hospital, and please accept my welcome to the community, staff, and our honored guests in attendance. A special thank you to Governor Lamont, Department of Emergency Services and Public Protection Commissioner James Ravella, State Office of Policy and Management Under Secretary Mark Pelka, Executive Director of Hartford Communities That Care Andrew Woods, Hartford Mayor Luke Bronin, State Representative Matt Ritter, Senator Richard Blumenthal, and Senator Chris Murphy, if he makes it. On behalf of myself and Dr. Jen Martin, who is our most recent Chief Medical Officer, but who also represents our emergency department and the incredible work they do each and every day. As an ED physician, Dr. Martin has been on the front lines here at St. Francis since 2012, and so on behalf of both of us, thank you for joining us today as we continue to work together to end crime and violence in our local communities and around the state of Connecticut. Our mission at St. Francis, a member of Trinity Health of New England, is to be a healing and transforming presence in the community we serve. St. Francis is proud to stand with each of you today as we raise awareness about the impact crime and violence has on so many. Today, we offer our deepest sympathies to all those who are suffering losses. We offer hope that just as we are standing today here in unity, the nation will come together in harmony. We thank those who serve to protect our communities in a safe and just way. And I'd now like to introduce Mark Pelka, Undersecretary of the Connecticut Office of Policy and Management. Mark.
Thank you. Thank you very much, Mr. Burke, and thank you everyone for gathering today. I'm looking out and seeing some familiar faces who have shared stories with me that have left an indelible impression on my heart, on my soul, and my mind. And I'm so honored to be around trauma surgeon and medical teams from St. Francis. Those individuals see the impact of bullets on bodies that rip through disproportionately black and brown bodies. In Connecticut, 56% of gun violence victims are black people, 5 times the population residing in this state. And also in Connecticut, young black men are 39 times more likely than white men to be slain with a gun. When a person is shot or dies of gun violence, the bullets ripple not just through that body, but through the community, through the home, the neighborhood, across the city, across the state, across the country. It leaves mothers and fathers, churches, civic organizations, and many more feeling broken, torn apart, unable to move forward. But the people I'm looking out and seeing in front of me today did move forward, and they rallied together as communities, from Andrew Woods to Mothers United Against Violence to so many other organizations in the community level that are here, neighborhood level. And in spring of 2020, as the impact of the pandemic on the criminal justice system began to appear, it seemed that perhaps there would be a slowdown in criminal activity and arrests. But as the pandemic stretched on, criminal activity rebounded, and some more sharply over the traumatic period affecting our states. Many cities around the country are experiencing increases in violence. And although Connecticut has experienced dramatic reductions in violent and property crime over the last decade, we are not immune from the effects of this global pandemic. And although property crime is down, many jurisdictions are seeing motor vehicle theft increasing. So for perspective, the amount of serious crime is at half the level it was in the 1990s, but the increase in violence in our communities is unacceptable. And it brings us all together at the federal, state, and local level to combine forces to stop the violence, to save lives, to impact communities. Much of the impact of the pandemic had an effect on health, economic, job, housing, and security. Impact on youth, dislocation from after-school activities, in-person schooling, dislocation from the supports that these young people need to thrive in their communities. While criminologists and experts are identifying what factors are impacting the crime trends that we're seeing, we must work together, community, local and state agencies, everyone, all hands on deck, to address violence, to address crime facing our communities. Last week, the Biden-Harris administration announced an ambitious plan to pool together resources and policies and supports to states like ours. They cited the importance of the flow of firearms, supporting local law enforcement with tools to help during summer increases in violence, investing in evidence-based community interventions, summer programming, helping people who are incarcerated reintegrate, receive the supports that they need. Well, Crime is always evolving. It's an entirely local phenomenon, and it's always complex. And an issue like auto theft that we've heard about is not located just to affect the suburbs. Cities in our state experience auto theft at 2 to 3 times the rate of the statewide level, many times more among certain towns. So you can have both towns showing increases in auto thefts and cities having unacceptably high rates of auto theft. That even though auto theft has gone down in many cities in our state, it still hovers above the state average. This is not a local phenomenon, it's more of a regional. And over the last decade, this issue has spread into larger portions of our state around the Waterbury, Hartford, New Haven area. And law enforcement and community members are reaching out for tools on how to stem the tide, how to reduce the violence. So we have two issues I've cited so far: the increase in violence, gun violence in our cities, the increase in auto thefts in many cities in our state and jurisdictions. The third is overdose deaths. That while the country was grappling with a public health emergency, another emergency sustained itself and grew more complicated. That is the accidental overdose death. From 2019 to 2020, the number of accidental drug overdose deaths in Connecticut increased 14%. Significant increases among non-Hispanic black populations as well. Fentanyl still comprising 85% of those drug overdose deaths. More potent drugs entering the stream. Very concerning. And as the pandemic's effects have begun to recede, these issues have persisted. So Governor Lamont today is announcing he's heeding the call of the Biden-Harris administration to make resources available as quickly as possible to jurisdictions that are experiencing increases in gun violence, increases in challenges like auto theft, public health challenges like drug overdose deaths. Governor Lamont is announcing today $5 million from CARES Act funding to be made available as quickly as possible to address these challenges and others facing our state. That just as Connecticut has seen dramatic reductions in crime, we must always remain vigilant and active in addressing those challenges as they confront. Connecticut is blessed with a federal congressional delegation. I see Senator Blumenthal is here today, and Senator Murphy, we believe, is on his way, and perhaps other members of the congressional delegation. Those members fought for Connecticut for CARES Act funding, for other stimulus funding. They fought hard for the American Recovery Plan Act. And we need all hands on deck, all resources to have the impacts that we need to keep our communities safe, to save lives, to avoid the tragedies that bring us all together today in events like that. So I'm going to outline very quickly some of the elements in the plan today. It will be evolving, because what's essential is that the state listens to the communities that know these issues the best. Listen to chief law enforcement officers. Learn what the challenges are and what opportunities are there to help, and use that to craft a plan to help in real time to those challenges. So the 3 columns. The number 1 column is to provide expansion of community outreach to neighborhoods, to hospitals, like the tremendous work that Andrew Woods does with Hartford Communities of Care, to neighborhoods, specific locations and cities that are experiencing spikes in tension, in conflict, in retaliation, all of which can lead to gun violence. Same outreach to be taken for communities impacted by drugs. Communities are experiencing heightened risk for drug overdose. We're talking peer navigators, peer support specialists, harm reduction outreach. So many organizations we know in Hartford doing that critical work, New Haven, Bridgeport, Waterbury, and so many others. Number 2, increase availability and access to real-time data, tapping into our real-time data centers in cities in our state so we can share that information regionally, share that with the state, share it with the feds. Concrete impacts, like launching a new NIBIN system to provide swifter analysis of casings from firearm ammunition expired, shot. Number 2, funding for DNA testing so we can more quickly process DNA evidence to connect it to existing cases inside the network and help to solve cases more quickly. Funding for the Chief Medical Examiner's Office to the forensic scientific analysis to look at what drugs are causing people to overdose and how can we better prepare our residents for the proliferation of these impacts. Finally, number 3 is think more regionally in responses to crime. Provide funding for critical task forces to be set up to address challenges that do not live within one city's or one town's borders. Bring people together on the table to focus those resources to bend the curve to increase safety. And finally, to deploy specialized officers to work in jurisdictions that have specific needs. These are very precisely drawn challenges, that don't require across the board. These are targeted approaches addressing specific challenges, bringing together the community, bringing together the police, bringing together all hands-on-deck approaches. And I applaud Governor Lamont for leveraging these resources made available by the federal level, by our congressional delegation. I applaud the legislators, the lawmakers, and the Speaker of the House, to Senator McCrory, to Representative Berry, to Representative Hall. Am I forgetting anybody? I don't think so. To join us here together, and all the hard work they did this session on legislation to add Waterbury as a Project Longevity site, to declare racism as a public health emergency and set up a gun violence reduction group, to extend Medicaid coverage to people receiving community violence, victimization, and services. It truly is an honor for me to be among these individuals who are fighting every day within our neighborhoods, within our cities, our state, and our country to save lives. Thank you. I have the tremendous honor next of introducing our Commissioner of the Department of Emergency Services and Public Protection, James Ravella. I'm tempted to always call him Chief, but today he's Commissioner. Thank you, sir.
Thank you, Mark. Hey, good morning, everyone, and thank you for coming, and thank all the guests for coming also, and our valuable partners that are in the crowd today. You know, after 40 years of law enforcement, especially at this time of the year, right, the epidemic is upon us once again. That epidemic is those folks that are shot non-fatally and both murdered by handguns. And that's what we're talking about. Mark laid out very eloquently the holistic approach to what we're trying to do today. I'd like to thank the governor for his support for the emergency services and public protection. So I'm going to lay out just a little bit of what the state police and what emergency service and public protection can do for everyone, and then thank some of our additional partners. I'll start with our partners. You know, all the police chiefs in all these cities and towns that have that collaboration with us, that have that conversation, that show us different things that they're seeing, both data and what their gut feeling is and what they're hearing from their law enforcement officers. That is important to us to hear. I'd like to thank the Department of Correction, who isn't here today, but is working with these cities. The parole, probation, are all working outside of their boundaries and engaging with police departments around the state. You know, the colonel from the Connecticut State Police, Colonel Malikas, has been wonderful as far as sharing his resources. To date, we have over 30 detectives and office troopers embedded with our federal partners, our FBI, DEA, because that is the connection. Not only are cities and suburbs connected, but we're connected by crime, we're connected by drugs, we're connected by stolen guns, we're connected by stolen cars. The connectivity exists, it has always existed for us. Recently, we sent 38 troopers down to Bridgeport last Thursday and Friday, just to assure that they had a peaceful funeral, wake, and repast for 2 homicide victims down there. That is the partnerships we want to develop and build on. So let me talk just a little bit about the forensic laboratory in Meriden. And Dr. Valero, I'd like to thank him even though he couldn't be here today. And the governor for financing a few neat and kind of technological advancements that I'm hoping to show everybody and the governor very soon. NIBIN, which is the National Integrated Ballistics Information Network, and it takes casings that are recovered from the streets in all your cities and all your towns around the state. We're opening a 24, 7-day-a-week kiosk in Meriden, Connecticut. The second facility will be mobile, and it'll also include a testing position where you can actually test a firearm, recover a casing, and then get it entered in a very timely manner. And this one's a neat one, rapid DNA. So source DNA, there's a kiosk opening in Meriden. It's open 24 hours, 7 days a week. And Waterbury Police Chief Spagnolo has agreed to house the second one, where violent crime testing can occur in a rapid and almost a 3-hour time frame if it comes back to a sole source. So we're interested in all those physiological fluids, folks. Your blood, your saliva, your semen, your perspiration, which has epithelial cells in it. So we want to bring these investigative aids to bear in a more timely manner and in a manner that can help solve a crime. And with that, you also solve the threat of retaliation that moves forward. So we're going to be showing that to you in a little bit. So our partners are really embedded into preventing violence, preventing retaliation, our hospital systems, and we thank you all for that. So thank you. It's my honor to introduce Dr. Stephanie Montgomery, Chief of Trauma and Acute Care Surgery, St. Francis Hospital. Doctor.
Good morning, everyone. My name is Dr. Stephanie Montgomery, and I'm the Chief of Trauma and Acute Care Surgery here at St. Francis Hospital. Today, our St. Francis family is proud to stand with you all, committed to a future free from gun violence. We stand in solidarity with our community. We are saddened that every day, Americans, including our neighbors here in Hartford, are needlessly killed due to gun violence. Firearms are associated with a high morbidity and mortality, with almost 115,000 Americans shot every year. For each victim of gun violence, there are scores of others directly and indirectly affected. Mothers, fathers, brothers, sisters, children, grandparents, friends, teachers, and many others too numerous to count. At St. Francis, we are committed to doing our part to continue the fight against gun violence in our communities. We are proud to partner with the City of Hartford and the Hartford Police Department each year for our gun buyback initiative. We will continue to join in these programs. The trauma team at St. Francis vows today to stand with you all and anybody who's affected by this scourge, and add our hope to yours that one day this issue will just be a footnote in history. Thank you. And now I need to introduce Andrew Woods to the podium to say a few words too. Thank you.
Thank you. Good morning, everyone. My name is Andrew Woods. I'm the Executive Director of Hartford Communities That Care, but also the Director of the Connecticut Violence Intervention Program, hospital-based violence intervention program here in the state of Connecticut. In 2004, we established the HVIP here in partnership with St. Francis Hospital. Up until just a few years ago, we had served over 800 victims of violent crime. Interestingly and tragically, over the last 20 months, we have actually responded to this hospital over 300 times for both fatal and non-fatal victims of violent crime, not just gunshot victims, but also stabbing victims and blunt force trauma victims. As been laid out here today, in terms of the kind of services that many victims receive, it's not only just the looking out for retaliatory instances where we want to prevent that, we also want to make sure that we connect families to services like in-home medical care, behavioral health support, and then routing them back to St. Francis or other medical providers for primary care services. There are like 40 of us across the nation that actually do this work when it comes down to hospital violence intervention programs here in the nation. And again, we're grateful for President Biden for hearing our pleas and making sure that entities such as ours, violence prevention professionals, as well as hospital violence intervention programs, receive the kind of services that they need and so forth. But I'll tell you something. We are terribly under-resourced. Doing this work is 24/7, 365 days a year, and here in Hartford, Bridgeport, and New Haven, and across the nation, there's literally anywhere between 2 and 6 people that actually get out of their beds on a day-to-day and nightly and early morning basis. And at the scale that we're operating at now, in terms of the kind of violence that we're seeing play out inside our communities, again, it's like drinking from a fire hydrant when it comes down to connecting with individuals who are at risk for violent injuries, but also supporting them and their families. So I'm grateful and pleased to be here with the governor and others who are behind me to make sure that some of the ARP dollars are coming to organizations like ours across the state and across the nation. But I'll tell you something, again, this is an issue that needs to be ramped up. It needs to be staffed up to the levels that meet the need. The last piece that I do want to point out here, the ARP dollars is just a tool. It's just a resource. It's a short-term resource. And I encourage the governor and our lawmakers behind us and others to consider more long-term sustainable funding to help us meet this need that seems to be going nowhere in many respects. And I'm not saying that we're not successful when people are not successful here in this hospital or elsewhere and law enforcement is not successful with doing some of the intervention and the work that they're doing. But what I'm saying is that there are countless people who are in need of these services, and again, we're under-resourced. A couple of weeks ago, thankfully to Speaker Ritter, Rep. Hall, Rep. Gilchrist, Senator McCrory, they were able to push through a bill that we asked them to push through, which was to get Medicaid reimbursement for violence prevention professionals. We are actually the first in the nation, and thank you, Governor, for signing that bill, to actually get that kind of bill across the finish line. And I want you to think about that for a minute. This is an issue that, quite frankly, very few people even give a damn about. From lawmakers, the funders, you name it, and as soon as the bullets stop flying, all of a sudden the issues go away. When in fact, people are still being injured in our communities, but not at the levels that they're being injured at now. So I don't want folks to think that all of a sudden, just because something's being dropped on the table, that this issue is all of a sudden dealt with. It is not. When we started this program here, Brother Carl Hardick and I started this program here in 2004. He's 80 years old. I'm, believe it or not, 60 years old. What we're trying to do is make sure we got the bench built so we can continue to get people trained up, certified to be able to do this work so that our services in our community can benefit from these services. And at the same time, obviously, reduce the kind of carnage that we're seeing inside of our community. So again, I want to thank the folks who are here today, but I also want to, again, thank our lawmakers like the ones I just outlined, McCrory, Ritter, Gilchrist, Hall, and the governor for getting that bill across the finish line. And Governor, I hope that we're looking forward across the nation for that ceremonial signing, because it actually signals to the whole country that this is the direction that we need to be going in, as evidenced by what the President has also instructed Medicaid directors to do, which is to support violence prevention professionals who are trained and certified. Thank you for your time.
Thank you, Mr. Woods. And it's my honor to introduce the mayor of the city of Hartford, Mayor Luke Bronin. And this is a bit of addition to my remarks. I want to acknowledge his leadership in emphasizing the ARP dollars to the city of Hartford, looking for innovative and dynamic ways to use these funding. He's been a real model for across the state on this area. So Mayor Bronin, thank you for being here, sir.
Thank you so much, Scott. Governor, thank you for your leadership on this. Senator Blumenthal, thank you for all the work that you and Senator Murphy and Congressman Larson and the whole delegation are doing down in Washington. Speaker Ritter, Representative Hall, Senator McCrory, Representative Berry, and the legislators who pushed for innovative fixes like that Medicare eligibility. Thank you for not just your leadership, but your creativity to figure out how we can make a difference. And of course, to all of our partners in law enforcement at the state, in policy at the state, in trauma surgery here at St. Francis, saving lives day after day, and to our community partners, Hartford Communities of Care, Mothers United Against Violence, Compass Peace Builders, and so many others. We all know that the crisis we're seeing here in Connecticut and across the country is deeply rooted. It is not simple, and tackling it requires us to partner at every level and in every way: federal, state, local, public and private, community and law enforcement. And I'm grateful that we now have an administration down in Washington and leadership in the Congress that have provided some resources to allow us to do a little bit more. As Scott said, here in Hartford, we have dedicated a significant amount of our American Rescue Plan resources to community safety and wellness. Not just violence intervention, but mental health. And as was mentioned earlier, the simultaneous challenge of overdose fatalities. And of course, our law enforcement is working hard. They're working hard to prevent crime. They're working hard to solve crime. And here in Hartford, they have been solving homicide cases and non-fatal shootings at a rate that we haven't seen in many, many years. And I'm deeply grateful to our police for their incredible work. But the goal is not just to solve, it is to prevent. And that is what is powerful and important about the resources the governor has put on the table in partnership with President Biden, in partnership with all the folks who you see here today. It allows us to do more. It allows us to resource better those community violence intervention programs that Andrew spoke so eloquently about. It allows us to enhance some of those law enforcement partnerships that have let our police, helped our police close those cases faster. A real-time crime center, getting quick hits from the knife machine so you can match those weapons. That stuff matters. And so it's not one thing. It's all of that together. And as we continue to fight this fight, keep our community safe, to say that this crisis of gun violence has to be treated with the same level of urgency and the same common commitment with which we tackled the COVID pandemic. We're lucky in Hartford and in Connecticut to have everybody working the same way, everybody pulling in the same direction. So again, to our delegation, thank you. To our federal delegation, thank you. To our law enforcement partners, thank you. And Governor, thank you again for acting so quickly to make sure that these additional resources were available. I think it's now my privilege again, with huge thanks to all of our Hartford delegation, which is united and strong in this work. Senator McCrory, Representative Hall, our entire delegation. But it's now my privilege to introduce our representative from Hartford, but also the Speaker of the House of Representatives, and somebody who I know is working so hard to do more on this issue, Representative and Speaker Matt Ritter.
I'll be brief, and I do want to thank the mayor for his comments, everybody who's here today. And I was talking to Doug and Josh back there and Jill Berry, who's joined us. Everyone laid out the stats, and I can tell you all the great things we did in the state budget to provide for our cities, Hartford, New Haven, and Bridgeport, getting them pilot money so they can pay for services, right? Making sure that we have legislation that affects criminal justice reform for reentry. We have things around child care and Medicaid enhancements that Andrew mentioned. But the hardest part for someone like me, or for Doug, or for the mayor, or Josh, or the Hartford delegation, is when someone calls you, like Treasurer Wooden, and it's one of his family members that's shot. It's a town committee member who says the shooting happened across the street from my house. It's people that you played sports with, that you worship with, that it's right in their backyards. So the message to everybody here is it's not just statistics, folks. It's happening every day at an alarming and increasing rate. So it's going to take everybody to do their part. It's a matter of making sure that you talk to your legislators in your districts that may not be Hartford, Waterbury, New Haven, and Bridgeport to support these policies. It's making sure that you thank our professionals at St. Francis and Hartford Healthcare every day for the great work they do. But I can tell you, beyond the stats, we're all nervous. Let's be really honest. We're all very nervous what the summer is going to bring for Hartford and those big cities. So it's a matter of making sure we fund youth programs, make sure there's schools that are open 24/7 with air conditioning. Donate to your Boys and Girls Club so they can be open and have more services and provide more hours. You can do more even if you live in a different town, even if you don't want to get involved in politics. There's always more that can be done. Churches making sure they're open, food, making sure we can feed our kids, and after-school programs. All those things matter. It's not one answer to this problem, but it's a collective problem for the state of Connecticut because the tragedies that happen here have such a ripple effect in our communities and across our state. Thanks, everybody, for your support today, and it's my pleasure to introduce our U.S. Senator, who does a hell of a job for us in Washington, Senator Blumenthal.
Thanks. Thanks, Matt, and thanks for your leadership. And Hartford surely has one of the best delegations in the state of Connecticut. Thank you all for your hard work. I want to give, first of all, another heartfelt shout out to the docs like Dr. Montgomery and Dr. Martin and all of their team. St. Francis really has been at the tip of the spear in fighting the pandemic and now fighting this epidemic of gun violence, car theft, and other criminal signs of the spreading mayhem across the country. These phenomena, gun violence, car theft, and drug overdose, are the pathogens. Guns, cars, and drugs are the tools of a trade, a vicious, pernicious trade that sends bodies to this hospital. The most important thing about this $5 million is that it sends a message. It won't accomplish everything you've heard today, We need much more money from the federal government to accomplish those goals. And so as important as the CARE aid is and the American Rescue Plan, which are the source of a lot of the resources that you're seeing go into communities now, we need to do much, much more. Infrastructure light is unacceptable. We need to think big and act boldly, because this uptick in crime involving car theft, drug overdose, gun violence is a spreading pathology that has no magic panacea to cure it, involves simple resources devoted to it as a way to stop it, and a combined effort that you're seeing here today. I want to thank the governor for recognizing the priority that ought to be attached to this kind of threat to our society, and recognizing as well that crime is an ecosystem. We're not going to arrest our way out of this uptick in crime. We're not going to do it only through the criminal justice system, but we have to support police with the resources that they need. There has to be support as well, equally important, for those community organizations, and there's so many good ones in Hartford that are doing the outreach, that are on the streets and in the neighborhoods, dealing with the human impact. And of course, professionals, not only the medical professionals here at St. Francis, but also the mental health professionals. They too need support. So we're committed to stopping this crime ecosystem, car theft, gun violence, drug overdoses. They are the pathogen, but we need to combat them as relentlessly and tirelessly as we did the pandemic, because they are every bit as much a threat to our society. Thank you to the governor. Thank you to everyone who is here today. I will take this picture back with me when we are debating what the resources should be going into the infrastructure bill, and say to my colleagues, Hartford and Connecticut are providing a national model, how to do it right. And thank you to the governor for his leadership. I'm proud to introduce him now.
Thanks, sir. We keep coming back to St. Francis Hospital for a variety of reasons, one of which everybody standing here today, I think our number one responsibility to you is to keep you safe and keep you healthy and keep you out of harm's way, whether you're a public official, a state law enforcement, or work here at St. Francis, and each and every one of you. I've been coming here for months during the pandemic, and what you've been able to do. And we're not done yet. You know, I look around the world, I look around the country. While Connecticut's more likely to be vaccinated and less likely to be infected, I see what's happening in Missouri. I see what's happening in Arkansas. I see what's happened in some of those states that are less likely to get vaccinated, and you do see the flare-ups there. So our work is not done, and I really need the healthcare community, along with the public officials, to keep taking the lead to make sure that people do the right thing. I also notice it's going to be one of the hottest days and hottest weeks of the years, and we're trying to tell everybody stay inside and stay cool. You know, practice what you preach, I guess. And dial 211 if you don't have a place to go. Luke Ronan here in Hartford and everywhere around the state will find a safe place for you can be. And we were all here, weren't we, many of us, a few weeks ago. It was about National Gun Violence Week. And I want you to know those aren't just words, but those are things that we act upon to keep you safe. And while I'm proud that Connecticut is one of the safest states in the country, we are not immune. We are not an island, and I see what's happening in other cities and states, and our violence is spiking up as well, in particular gun-related violence. And as you heard from James, and as you heard from Mark and others, two very specific things that I think we're taking the lead on
that are going to make a difference. You know, one, be it guns, be it opioids, be it carjackings, they do not stop at a municipal border. It's not like Butch Cassidy and Sundance Kid. You get across the border and I'm done. I'm free. That's not the way it works. And we are working very carefully with some of the state and federal money going out to the municipalities to create regional data centers. We'll be able to track with the forensics, track shell casings, track where this gun came from, where this car came from, and be able to do this on a regional basis. And with Senator Blumenthal and ATF, do more and more as we can on a federal basis as well. Because as you know, these guns come down from Vermont, they come up from Georgia, they don't just come from one town to the next. And finally, it's not all about law and order, it's also about understanding what our population's been through over this last year and a half, in particular our young people. You know, that's why, you know, Dick, we're so thankful for the American Rescue Plan money and what the Mayor Broden and mayors across the state, as well as our superintendents, are doing, getting the free learning camps available to these kids, help them get off the street, help them stay cool, help them get back in the game. We're able to do to get our kids back in school, give people a little bit of hope and a little bit of opportunity. I think those are the two ways we go at this battle right now. But we're here because the weather's getting hot. Tempers sometimes get a little hot. People get jazzed up on Facebook. And we got to do everything we can to help people stay cool. And I think a lot of the programs you're hearing today are going to keep our cities and our towns safe because we're all in it together. Thanks, everybody. Anybody else want to give a speech?
It's a long program, no denying that.
Commissioner Vella? Commissioner, come to the...
Yes, Mark.
Just help to start off by talking about the complexity of criminal justice policy, but the politics tend to be very simplistic. Penalties are either too hard or too easy, we're locking up too many, not enough. So I want to ask you about what is your opinion as far as whether or not Connecticut has the tools to deal with juveniles who are arrested multiple times for park theft?
So Mark, you're talking about a specific group of juveniles. Do we have the tools? I believe that we can develop those tools. Presently, we need more prevention with those folks, more education with those folks. And ultimately, some of those juveniles are going to spend some jail time. Most of the chiefs that I've spoken to around the state, they didn't get their bracelet that they wanted to track those folks as second and third offenders. That's something for the legislature and us to continue to work on. But that opportunity is there for us, Mark.
Was that a mistake, though, not to do that program with the bracelet?
I wouldn't call it a mistake, Mark. Data is important, but we're not seeing the data that says it's just underage, under 18, right? We're seeing young adults do it also. So the data is not clear to that point. So data is important to us, as you know from being in Hartford. The consumption of data and the distribution of data to go with it on a real-time basis. That's what you're going to start to see from the state lab. Although we've given priority DNA services to the more complex cases and to the shootings around the state, we've also opened the door for NIBIN cases that come along more quickly. Rapid DNA, if you're a sole source, you're going to have rapid DNA and a lead to work on within 2 hours. That's important. And that's going to be available 24 hours, 7 days a week. All right, so I'm not at the police chief level any longer, but when I was the chief in Hartford, we noticed that retaliation and the prevention of retaliation was key, meaning our folks with Mothers United Against Violence were those folks that went into those distressed households of those victims and their families and started to talk about closure. Let the police handle it so you can have closure. If the mother draws the line and says that the police will handle it, that really stems retaliation. So it gives them the chance to grieve. and grieve properly. So they were a great partner. But it's not just the police. I'll tell you that right away. It's those folks that prevent it. It's those folks that are there that moment in time, like Andrew Woods and company, that moment in time, St. Francis Hospital, Hartford Healthcare, and other groups down the line. We're in charge of finding out who did it and making a case.
And maybe Andrew can say something.
How many more resources, the Medicaid reimbursement and the federal funding, how many more resources does this give your organization?
Well, first, I just want to go to that retaliation piece. One is that anytime a person is violently injured, oftentimes people feel the need to maybe want to retaliate. And that's where intervention specialists come into play. Rather, it's organizations like ours, Compass, Mothers, or other groups across the state. They come into play to intervene at the earliest possible moment, and oftentimes within hours of the shooting, to try to get the folks to make sure that they don't come back, and they also don't send themselves back here to the hospital in reaction to that. And so oftentimes, many times, a shooting victim actually is a repeat shooting victim, because we oftentimes have to get ahead of that as well. And so it's very key to make sure people get the services and supports that they need, but also those direct, immediate, acute interventions to drive down those retaliatory violence that we often see. As it relates to Medicaid, it works just like licensed clinical social workers. There is a fee that will be set, which we don't have that fee at this time. The bill just got passed. It is a fee that will be set that will actually reimburse violence prevention professionals who have been trained and certified by a national entity called the Health Alliance for Violence Intervention Services. And they're working closely with, as our partners are, with DSS and others to start structuring the way that should look. But I don't have exactly what the rate is at this time because it hasn't been set.
I can't hear words you say. I'm sorry. Right. Well, honestly, I didn't get to see the legislation, but I understand what you're talking about. Car theft is not a new issue in the city of Hartford or in the state of Connecticut. It's been highlighted recently because what we've seen is the age of the people who are actually taking the cars. And I'll be quite honest with you, it's an issue. It's an issue that we have to address. Now, do we have to pass legislation? I'm not quite sure, but I do realize this, and then we talk about violence. It's not a large population of individuals that have committed these crimes. And we can identify these young people at a very early age. They're the kid that dropped out of school in 9th grade, or the kid that's been retained 2 or 3 years. They're the kid that have a family person that's probably been impacted by the criminal justice system. We can identify these young people at a very early age. So once we get to about 16 or 17, it's too late. We got to address this issue at 13, 14 years old when they're in middle schools and put the programming in place and put the people in place in these places where these kids are, mainly in their schools and their communities. So that's what if we want to really get to the root cause of this substantial institutional issue that's been going on for years, that's where we have to start. Legislation, if we're getting to the point that we have to create legislation to do something about it, then we'll miss the ball. This has to be started at a very early age, middle school, identifying the kids who have been retained, been dropped out, who are in school physically but not in school mentally. It's been going on for a number of years, and unfortunately it took a situation like this pandemic to shine a light on something that we've been talking about for a very long time. Very long time. So I guess that's my best answer.
So this money is specifically targeted for gun violence prevention. What are you doing to address to reduce crime overall?
This money may be for gun violence, but you also heard President Biden say the other day he gives mayors across the country the opportunity to use more of their ARP money towards reducing gun violence and giving kids alternatives that maybe keep them out of harm's way. I can tell you that we as a state have done a lot of things in terms of helping to support Hartford communities, the care, helping to support other programs that provide intervention, working closely with mayors, providing a lot of other social support services for the kids and their parents going forward.
You said that, obviously the pandemic has impacted
we haven't made up our mind on yet, but if we do, it's not for very much longer, because we finally have Department of Housing over the last month has been able to take care of more and more of those tenant-landlord disputes. Our court systems are opening up now, able to handle more and more of those tenant-landlord disputes as well, and also handle a lot of these type crimes so they get adjudicated properly. Thanks, everybody.